Hypertension, or high blood pressure, often produces no symptoms, but it can increase the risk of heart disease, stroke, and other serious health conditions. What is hypertension? Blood pressure is the force that a person's blood exerts against the walls of their blood vessels. This pressure depends on the resistance of the blood vessels and how hard the heart has to work. Certain conditions, medications, and health factors can increase this pressure. Hypertension is blood pressure that is consistently higher than 140/90 mm trusted source of mercury. The systolic reading of 130 mm of mercury refers to the pressure as the heart pumps blood around the body. The diastolic reading of 80 mm of mercury refers to the pressure as the heart relaxes and refills with blood. The American College of Cardiology and the American Heart Association define blood pressure ranges as systolic, diastolic, normal blood pressure less than 120, less than 80, elevated blood pressure 120, 129, less than 80, grade 1 hypertension 139, 89, grade 2 hypertension 140, and over 90 and over. Hypertension is a primary risk factor for cardiovascular disease, including stroke, heart attack, heart failure, and aneurysm. Managing blood pressure is vital for preserving health and reducing the risk of these dangerous conditions. Almost half of all adults' trusted source in the United States have high blood pressure, but many may not know they have it. Symptoms. A person with hypertension may not notice any symptoms. Without detection, hypertension can damage the heart, blood vessels, and other organs, such as the kidneys. It is vital to check blood pressure regularly. In rare and severe cases, high blood pressure can cause sweating, anxiety, sleeping problems, blushing. However, most people with hypertension will experience no symptoms at all. If high blood pressure becomes a hypertensive crisis, a person may experience headaches and nosebleeds. Complications. Long-term hypertension can cause complications through atherosclerosis, where plaque develops on the walls of blood vessels, causing them to narrow. This narrowing worsens hypertension because the heart must pump harder to circulate the blood. Hypertension-related atherosclerosis can lead to heart failure and heart attacks, aneurysm, or an atypical bulge in the wall of an artery that can burst, kidney failure, stroke, amputation. Hypertensive retinopathies in the eye, which can lead to blindness. Regular blood pressure monitoring can help people avoid these more severe complications. Measuring blood pressure. High blood pressure for a short time can be a normal response to many situations. Acute stress and intense exercise, for example, can briefly elevate blood pressure in an otherwise healthy person. For this reason, a diagnosis of hypertension requires several readings that show sustained high blood pressure over time. Causes. The cause of hypertension is often not known. In many cases, it is the result of an underlying condition. High blood pressure that is not due to another condition or disease is known as primary or essential hypertension. If an underlying condition is a cause of increased blood pressure, doctors call this secondary hypertension. Primary hypertension can result from multiple factors, including having obesity, insulin resistance, high salt intake, excessive alcohol intake, having a sedentary lifestyle, smoking. Secondary hypertension has specific causes and is a complication of another health problem. Chronic kidney disease is a common cause of high blood pressure, as the kidneys no longer filter out fluid. This excess fluid leads to hypertension. Hypertension can also cause CKD. Other conditions that can lead to hypertension include diabetes, due to it causing kidney problems and nerve damage, pheochromocytoma, a rare cancer of an adrenal gland, Cushing's syndrome. Congenital adrenal hyperplasia, a disorder of the cortisol-secreting adrenal glands. Hyperthyroidism, or an overactive thyroid gland. Hyperparathyroidism, which affects calcium and phosphorus levels. Pregnancy. Sleep apnea. Risk factors. A number of factors increase the risk of hypertension. Age. Hypertension is more common in people who are over 65 years old. Trusted source. Blood pressure can increase steadily with age as the arteries stiffen and narrow due to plaque buildup. Ethnicity. Some ethnic groups are more prone to hypertension than others. African Americans have a higher risk. Trusted source than other ethnic groups, for example. Weight. Obesity is a primary risk factor for hypertension. Alcohol and tobacco use. Regularly consuming large quantities of alcohol or tobacco can increase blood pressure. Sex. According to a 2018 review. Trusted source, males have a higher risk of developing hypertension than females. However, this is only until females reach menopause. Existing health conditions, cardiovascular disease, diabetes, chronic kidney disease, and high cholesterol levels can lead to hypertension, especially as people age. Management and treatment. Lifestyle adjustments are the standard, first-line treatment for hypertension. Regular physical exercise. Current guidelines recommend that all people, including those with hypertension, engage in at least 150 minutes. Trusted source of moderate-intensity aerobic exercise every week or 75 minutes per week of high-intensity exercise. People should exercise at least 5 days every week. Examples of suitable activities are walking, jogging, cycling, swimming. Studies show that strength, or resistance, training can also reduce blood pressure. Trusted source in hypertensive people. Stress reduction. Avoiding or learning to manage stress can help a person control blood pressure. A few relaxation techniques that can help relieve stress are meditation, warm baths, yoga, going on long walks. People should avoid consuming alcohol and recreational drugs to cope with stress, as these can contribute to elevated blood pressure and the complications of hypertension. Smoking can also increase blood pressure. Avoiding or quitting smoking reduces the risk of hypertension, serious heart conditions, and other health issues. Medication. People can use specific medications to treat hypertension. Doctors will often recommend a low dose at first. Antihypertensive medications will usually only have minor side effects. Eventually, people with hypertension may need to combine 2 or more trusted source drugs to manage their blood pressure. Medications for hypertension include diuretics, including thiazides, chlorthalidone, and indapamide, beta blockers and alpha blockers, calcium channel blockers, central agonists, peripheral adrenergic inhibitors, vasodilators, angiotensin-converting enzyme inhibitors, angiotensin receptor blockers. The choice of medication depends on the person and any underlying medical conditions they may have. Anyone taking antihypertensive medications should carefully read the labels of over-the-counter drugs they may also take, such as decongestants. These OTC drugs can interact with the medications they are taking to lower their blood pressure. Diet. People can prevent high blood pressure by following a heart-healthy diet. Reducing salt intake. High sodium consumption contributes trusted source to high blood pressure. The main source of sodium in the diet is salt. The AHA recommends that people without hypertension consume less than 2,300 mg trusted source of sodium per day. This roughly equates to 1 teaspoon. People with hypertension should consume less than 1,500 milligrams of sodium per day to manage their condition. A healthcare professional can help people reduce consumption if they find it difficult to moderate their alcohol intake. Eating more fruits and vegetables and less fat. People who have high blood pressure or people at high risk of developing it should reduce their intake of saturated fats in favor of unsaturated fats. Learn more about saturated and unsaturated fats here. Experts recommend trusted source that people with high blood pressure prioritize more heart-healthy foods, such as whole grain, high-fiber foods, a variety of fruits and vegetables, pulses, such as chickpeas, beans, and lentils, nuts, fish rich in omega-3 twice per week, non-tropical vegetable oils, such as olive oil, skinless poultry and fish, low-fat dairy products, limiting trans fats, hydrogenated vegetable oils, animal fats, and processed fast foods can help manage blood pressure. However, some fats can be a healthful addition to diet plans. Omega-3 fatty acids, such as oily fish and olive oil, have protective effects on the heart. While these are typically healthful, people with a risk of hypertension should still include them in their total fat intake. Managing body weight. Excess body weight can contribute trusted source to hypertension. Blood pressure usually follows weight loss because the heart does not have to work so hard to pump blood around the body. A balanced diet with a calorie intake that matches the person's size, sex, and activity level will help. The DASH diet. The U.S. National Heart, Lung, and Blood Institute recommends the DASH diet, trusted source for people with high blood pressure. DASH stands for Dietary Approaches to Stop Hypertension. DASH is a flexible and balanced eating plan with a firm grounding in research by the NHLBI, which says that the diet